All right. Hello.
Hi, how are you?
I'm doing good, thank you.
Good, thanks.
So, what brings you here?
So I'm attending the Croi conference, and I'm also presenting a poster on one of our studies that we've done where we are assessing cognitive function in adolescents living with HIV based in Harare, Zimbabwe.
Wow. And are you involved with that then? The whole project and everything then?
Yes, I am involved with the project. I was the study coordinator of the project, and also I led the Zimbabwean team that was doing the project as well.
And what was the initiative of the project, if you don't mind me asking?
Sorry, can you get...
Well, like, what was the main point of the project?
Oh, okay. We found out that adolescents with perinatally acquired HIV, because aged 10 to 19, had poor cognitive function compared to their HIV negative HIV negative peers. That was the comparison group that we're using.
Okay. And why do you think that's important studying and bringing awareness to the public and the communities?
Okay, so cognitive impairment is very important because many a times, especially in a setting like Zimbabwe, which is a low resource setting, there are so many children who probably have a lot of different cognitive impairments and cognitive functioning. So sometimes they perform poorly at school, and maybe the parents don't even understand why their child is performing poorly at school. And also, we wanted to just look at what it looks like beyond just treating HIV as a chronic, what it feels like, what it looks like to treat HIV beyond it just being a chronic or viral condition where there's a lot of treatment. So this also explores the other chronic comorbidities that are associated with HIV.
Okay, man. And out of that research, was it successful, would you say?
Yes, it was very successful because, first of all, we found out that young adolescents with perinatally acquired HIV had poor cognitive functioning, and we also found out that the ones that were not growing as well as their HIV negative peers, so those that were stunted, like that means that they were shorter for their normal height or according to their age, they also had like poorer cognitive impairment. So that means that we need to look at nutrition in adolescents with HIV, and also we need to do active screening of their cognitive impairment as well.
And coming to this event, have you been here before?
No, this is my first time ever attending Croi.
Okay, and what do you think is really important about this event and bringing other colleagues like yourself amongst others?
Okay, I think Croi is a very good, from my small experience of having attended Croi this year, I think it's a very good opportunity to be able to to network and to also share science. I feel like this is a very science-oriented conference which focuses more on teaching and learning. I've learned so much just beyond the scope of my mind of working with adolescents living with HIV. I've also learned about what's being done in terms of looking for an HIV cure, what is being done in terms of finding a vaccine for HIV, and many other things that people are doing around the world. So I think that is a very good platform to be able to showcase that and highlight that about all the important work, and just not about HIV as well, and also about other viruses like COVID-19, hepatitis B, and so forth.
And how did you get in this field, if you don't mind me asking?
Well, I am a medical doctor by background, and then initially I wanted to be a pediatrician, but then I also wanted to do research. So apparently it turns out the research track came first before the practice to becoming a pediatrician.
Man, that's so great.
Yeah.
Thank you for helping the community, and thank you
so
for
much.
others. From this conference, what's one thing that you're taking from it that you're looking forward to bringing back to your community?
I think one of the most important things that I've learned is that there's still so much work to be done. And also today, something that I learned is that just don't fear about speaking out. Like people will not be able to guess what you're thinking if you don't speak out. So even if if you feel like you're not confident or you're a small fish in a big pond with like a lot of big fish, you still need to speak your mind so that people know what you're thinking and what you're advocating or what you're standing for.
Yeah, definitely. And what are you looking forward 2024 moving forward in the future with something that you just learned?
So moving forward, it's something that I've just learned. Actually, it's something that I'm just going to listen to tomorrow.
Okay.
Which is on insta resistance. So and insta resistance in low and middle income countries. So we know that most of the people who are being treated for HIV are now being put on newer drugs that are much more efficacious and that cause actually more viral suppression and robust viral suppression. So I'm going to be learning about the emerging drug resistance with that, which I think is something that is very new, because at the moment we are very excited about these drugs, but we don't know what the long-term effects of maybe not taking those drugs consistently will look like in the near future.
What do you think is like something maybe holding back being able to move forward, with all these drugs and these sciences, would you say?
Yeah.
Off the top of your head, that's really just like holding us up.
Okay. I think one of the things that's just holding us up is the fact that, there's a lot of work to be done, but then there's just little funding that's there. So most of the work, unfortunately, needs money to be able to sponsor it. You need to be able to have like enough resources for you to be able to do this amazing body of work. But then if there's no funding to do that, then unfortunately, so that's a very big limitation.
Sure.
Yeah.
And is there anybody that you would like to shout out to?
Yes, I would like to give a shout out to my research institute, which is the Health Research Unit in Zimbabwe, and which is based at the Biomedical Research and Training Institute.
Thank you so much for your contribution,
Thank
and
you.
I look forward to you and your help.
Thank you so much. Thank you very much.